From Kalamazoo, direct to you, it's a WKZO.com quickcast.
I'm Linda Vail Buzas. I'm the Director and Health Officer for Kalamazoo County, Director of Health and Community Services.
How serious are you taking the current flu situation in Kalamazoo County? How serious do you see it at this point?
I think you have to look at serious on a couple of different levels. And one is seriousness of the illness. And the illness is a very mild flu-like illness, very typical or common, similar to the seasonal flu. So at that level of seriousness, you know, yes, there have been some hospitalizations and deaths, but that happens with seasonal flu every year. 36,000 people die from seasonal flu every year. So this is very, very much just like the seasonal flu. In terms of the concern, the seriousness of it really is the numbers of people, especially young people, that potentially will become ill from it. And then your basic continuity of daily activities, continuity of, you know, operations, schools, because of the numbers of people that may be ill at any specific time. So because it's a new virus, because nobody has immunity to it and the vaccine is just coming out, that's the real issue, is that what we're seeing is large numbers of people all getting ill at the same time. Certainly significantly more people ill with flu-like illness at this time of year this year than there was last year or even the previous 3 years.
Do you see it erupt this early in the year with seasonal flu? Or is it because it is a new variant that is causing it to be as common as it is now?
Typically, you do not see widespread flu-like illness as early as we did see it this year. Now, we're coming upon October now. Our flu season typically is, you know, January, February, March. Occasionally, we start to see a peak in flu-like activity in December. So the widespread flu-like activity right now is unusual for this time of year. It's not because of this particular virus and it doing something different. It never went away. When it came in April, it stayed through the summer. Kids are going back to school. Kids are kind of the primary age group that are getting ill, so we've got them congregating all in one place in schools again. So as school districts are going back to school across the country, what we're seeing is more flu-like illness.
Is this H1N1 or is this seasonal flu? Has testing confirmed it's the H1N1 virus?
Testing right now confirms that the majority of flu-like illness that's occurring in the country right now is H1N1. There is some seasonal flu. So it's a mixture of the two. The vast majority of it is turning out to be H1N1 when confirmatory testing is happening. Not doing a lot of confirmatory testing at this point because, again, get back to the seriousness of it, it's the flu or it's the flu. Which flu it is really irrelevant if you're going to end up staying home, taking care of yourself while you're sick, staying home until you recover, and then going back to school. You know, it's the same illness, it's the same recommendations for taking care of yourself, it's the same treatment. Really the only time confirmatory testing is probably required is if somebody ends up in the hospital or in an intensive care unit. In that case, they might want to figure out which variant of the flu they're having. The other thing that is happening now is we are seeing the CDC ask for a little bit of confirmatory testing on some of the school dismissals. We've had some of the earlier school dismissals, you know, certainly in the state of Michigan. And so, you know, while we had a lot of illness in this school, is it H1N1 flu? Can we say that as we're doing school dismissal reporting through the CDC, which is a brand new thing. They're asking for that this year, and it's not typical that we do that.
Has any testing been done on the schools that have closed
yes,
at this point?
Some specimens have been collected from a couple of the schools that have closed at this point in time, but we don't have any results on those.
There were concerns voiced yesterday that this is more of an airborne virus than was previously thought. Have you seen any evidence of that? Instead of getting it from touching a doorknob or shaking hands, you can get it from being in close proximity. The figure I heard was within 10 feet of an infected person. Does that pass a reasonableness test?
The flu is a droplet-borne infection in terms of being transmissible. So it's not just off of surfaces. If you're within a few feet of somebody who coughs or sneezes, those particles can get transmitted along with the droplets that come with that sneeze or that cough, and you can be infected by that. Now, I've heard 3 feet, I've heard 6 feet, I've heard 10 feet. You know, rule of thumb with flu is usually 3 feet. You know, I don't think that we have, you know, in the limited time that this flu has been around, we have any hardcore scientific evidence that says that, you know, if you're 10 feet away, you're still going to get it, versus if you're 3 feet away, you know. So I don't know those numbers. Rule of thumb for the flu has been 3 feet.
Okay.
And this is very much acting like a typical influenza.
Okay. There have been previous pandemic flu episodes.
Mm-hmm.
There will be future pandemic flu episodes. How frequently do they happen, and do you know when the last pandemic that hit this country, when that was?
Yes. You know, we started talking about pandemic potential when we saw the avian influenza over in Asia start to erupt and cause some occasional human infections. And at that point, you know, we were educating people about the fact that about 3 times every century, if we look back, there's a pandemic. And so we were kind of due for one, because in the 1900s we had one in 1918, we had one in 1957, and we had one in 1968. So 1968 was our last pandemic, and here we are in 2009 with our next.
Okay.